Whiplash injuries are not simple neck sprains or isolated soft tissue issues. They're in fact a complex cervical kinesthetic system injury. If you understand this, you can rehabilitate people quickly and efficiently. Most providers in Ontario treat off of policies and procedures developed by Allstate in the 1990s to reduce claim costs, the QTF to reduce physiotherapy costs, or the intact policy to keep the minor injury guideline. This does not enable faster recovery. It reduces claim costs to the general population. Because of these policies and procedures of the 1990s, many current healthcare providers without specific training think that the injuries are self-resolving. Because of this, we see generic physiotherapy treatment, stretching, home exercises, heat and light massage as primary treatments. This will not get people better. The issue with whiplash is a significant force acts on the spine within about 60 to 80 milliseconds. And it's not just one force, it's actually six forces acting simultaneously. Because of the lack of training in whiplash specifically, many providers or so-called experts will consider whiplash as a unidirectional force. This changes how the person can get injured. This changes the injury kinematics. This changes the perception of injury thresholds. Those that understand whiplash know that a very low speed G-force can sustain significant injury. And this is because of the time that the injury occurs in, about 80 milliseconds. Those that do not understand whiplash look at the entire crash collision. And this is why you'll see those that aren't whiplash specifically trained saying that you need extremely high G-forces to sustain significant injuries. The problem is this then dictates treatment. And if a person does not get the correct treatment, they will not get better. When we look at the kinematics of a whiplash injury, the primary component is a straightening of the cervical spine. This results in ligament laxity and damage, articular capsule damage, and also brainstem concussions. By understanding crash forensics, we can see a very low speed collision, for example 6.2 miles per hour in this example, can result in significantly high G-forces acting on the neck almost instantaneously. When we hire ACRs to look at the collision, they use the entire totality of the collision, from first bumper strike to the car coming to a stop, which is about a half a second. That's why they say that it's a low G-force collision. This is not true. If we don't understand how the person gets hurt, we can't provide the appropriate treatment. Auto insurers have known that chiropractors are the primary treatment providers for whiplash since the 1990s. And that's why chiropractic cares cost more, because we understand the injury mechanisms and the appropriate treatment that is needed. Unfortunately, with those providers today that do not have whiplash specific training, they are treating under the guides developed in the 1990s to reduce cost, which are not supported by evidence. Because of this, patients do not get better, claim duration is elongated, and liability increases. For example, policies from the 1990s suggest whiplash is a soft tissue injury. We know better since the early 2000s with a recent study showing that there is no creatine kinase release after whiplash trauma, meaning there is no muscle damage. Another statement showing that this idea of low G-force can result in no injuries in a low-speed collision. This is the author of the article that was cited by the Quebec Task Force, stating that that was not what was tested and that was not the results of his tests in an affidavit in Arizona courts. Many generic mill-type providers believe that whiplash is self-resolving, again from the 1990s publications suggesting this. However, if you actually read the publications, you'll see that the idea of recovery was simply a return to work, not an end of disability, not an end of pain, not recovery in the sense of medical recovery. The problem with using generic physiotherapies is that they have this idea of what whiplash is, and the idea is that you don't have to really provide solid care to get benefits because it's a self-resolving soft tissue injury. That's not what whiplash is. If you treat like this, people will not get better. For your high value clients and your premier members, you want to offer a service that understands the injury, can treat the injury, and can get people back to work as quickly as possible. So here's the truth about whiplash and why this understanding of crash forensics is key to helping people recover faster. If we look at a typical collision, saying that the person was in a front-end collision or airbags deployed is not enough information. In the first video, you'll see that it's a direct head-on collision where airbags and seatbelts would provide support to prevent injury. In the second collision, you'll see it's an offset collision where there'll be a torque in the vehicle which will allow the occupant to hit the A pillar, meaning the airbags can deploy, the seatbelt can retract, but they provide no protective mechanism. If you understand the kinematics of injury, you understand how to treat someone specifically so that they get better quicker. In this example, it's a very low speed rear impact collision. What we can see is we can see the occupant's neck translate forward significantly past the physiological barriers for each segmental joint in the cervical spine. This is where you get ligament damage. This is where you get capsule damage. This usually goes under assessed in typical physiotherapy settings. When we don't understand how whiplash happens, we don't understand how to treat it. Research has shown the muscles in the posterior neck actually have an attachment to the spinal cord. So as our structure changes, we get tension on the spinal cord, which then affects our hypothalamus pituitary axis and results in chronic stress. In addition, there are connective tissue paths that connect muscles from the head to the feet. So everything really is interconnected. If we don't treat the correct structures, they affect the next structure down the line and so on. And that's why this is a progressive disease that can worsen if you do not give the right treatment at the right time. Once this pain cycle starts, we're starting behind the curve. We're starting at the altered biomechanics stage, whereas a typical hamstring sprain strain or an ankle sprain strain would start at the typical injury inflammation stage. With those, you can give medication, ice, and rest, and a lot of times they'll heal by themselves. Because whiplash affects our kinematics and alters our biomechanics, the treatment is completely different. And if we do not treat correctly, the disease process will be progressive and worsen over time. Another unique factor with whiplash is that it affects the facet joints, the facet capsules, and the free nerve endings inside the facet capsules. Research has shown that when these structures are affected, it will actually cause morphological changes in the spinal cord where pain fibers will migrate to the sensory portion of the spinal cord. This is why general movement patterns will cause pain even when there is no tissue damage present. The scary thing is this can happen within 24 hours after an injury. When we start to feel pain, it's very common to stop moving. This is called kinesiophobia, where you're afraid to move because you'll trigger more pain. The problem is when this is not corrected very quickly within the first 3 weeks post-trauma, you'll get something called fatty infiltration. The muscle that stabilizes your spine will actually turn into fat. You lose your foundational support, and this causes a substantial number of secondary issues after the primary trauma. Research has also shown once this fatty infiltration starts, it affects the way your brain functions, and you lose coherence, meaning your brain starts to race in all different directions to try to figure out what's going on instead of the shortest path possible. And this is why you see patients say they have brain fog, trouble focusing, and trouble concentrating. Left uncorrected, this can complicate people's ability to work, but it can also increase your risk, whereas this allows for a 20 to 30% whole person impairment by itself, according to the AMA guidelines. Another complicating factor with whiplash is the change in biomechanics, as we mentioned. On the right of the screen, you see two light microscope images of ligaments. The left ligament is a normal ligament. The right ligament is a ligament that was injured, did not receive appropriate care, and healed. You can see that it's structurally intact but functionally weak. This is why people have constant neck tension that never resolves with massage and physiotherapy. The scary thing with this is this occurs within 3 weeks post-trauma. As these altered biomechanics progress, you'll see patients develop forward head posture and rounded shoulders that worsens over time. The scary thing with this is research by Katch has shown that with forward head carriage, you can reduce blood flow to your brain by 30%. So think of Alzheimer's symptoms. And when you do have this ligament laxity that results in antro or retrolithiasis, this can equate to 25 to 35% whole person impairment alone. Now here's where muscle comes in. When you have joint instability, the muscle tries to protect by staying tight all the time. This is called muscle splinting, and it's shown with the graphs to the right. The muscle never electrically turns off. This is why patients are constantly fatigued and why they feel worse after treatment. So if you provide services and you don't understand this, you will make people worse. And the longer your clients get this improper treatment, your body tries to compensate. So it grows more arteries and more nerves in the area to try to provide support to the muscle. Well, now this leads to increased chronic pain because you have more nerve fibers sending more pain perception to the brain. It gets worse because the neck is directly connected to the eyes. So when the neck is off, it can cause loss of accommodation with the eyes. And this is why people will say that they get blurry vision looking at a computer, they get motion sickness in a car, they are more clumsy or bumping into things more often. Again, this can be corrected. If you send them to an optometrist, it won't recover because the issue is not in the eyes. The issue is in the information being sent from the neck. And this side shows an example. On the left, we see a cranial nerve 2-3 test that looks for pupil dilation. This simply says that someone's alive. On the right, we see a loss of accommodation where the eye starts to track in and follow the finger, but then loses ability to maintain that focus and translates out. This is what happens when someone's trying to use a computer or trying to read and they start to get dizziness, blurry vision, headaches, and trouble focusing. This is easily corrected with the right treatment. When we allow this whiplash injury mechanism to progress, the curve will also continue to worsen. Blood flow will continue to be reduced to the brain. CSF flow will be backlogged in the brain, preventing lymphatic drainage and clearage of debris. And this will cause a disruption in your alpha waveforms, which is your resting state brainwaves. Most of the time, it'll increase to beta. And this is where we start to see depression, anxiety, and psychological issues come about. With the presence of pain, it then affects your HPA axis. And your HPA axis can then affect your immunity, your hormone secretion, your ability to gain restful sleep, and a host of other issues as you keep in this fight or flight stance. Now, at this point in the recovery process, patients are said to have psychological issues. They have anxiety, they have depression, the pain is in their head. This is not true. From two of the leading psychiatrists in the world that deal with whiplash, they have shown that pain is the trigger for the psychological symptom and not vice versa. So in this research study, what they did is they took people with pain and psychological issues. Half got treatment only for pain, half got treatment only for psychological issues. The pain population completely resolved both pain and psychological issues. The psychological treatment group, they had one person reduce psychological impairment that still had pain. All other subjects still had both pain and psychological issues. Now, since the introduction of the LAT and then complication of COVID, AB claims have been lasting longer, some 7, 8, 9 years. Research has shown as your curve progresses, this will lead to myelopathies within 7 to 8 years, which puts you at higher increased risk for costs and claim duration. And if surgery is needed, it is not a minor surgery. So here's the truth about whiplash. In the longest study, Squires showed 30 years post-trauma, after all insurance claims were over, 70% of people were still disabled. And this is because improper care is given in the first month post-accident. Now, if you're wondering if your clients will have psychological issues and concussion type symptoms, mood changes, trouble with sleeping, all the answers are yes. And it's because when you're in pain, you will actually lose 1.3 centimeters of gray matter per year. And Stanford Medicine has shown that this doesn't matter if it's a 1 out of 10 or a 10 out of 10. So sending your clients to the wrong PPN is significantly risky. And as you can see, it also changes the amygdala. And the amygdala is your emotional response area of the brain. And this is why we see people get more emotionally distressed as the claim proceeds. Now, with advancements in neurophysiology, we can use special testing such as QEEG to determine a number of conditions, such as emotional and mood disturbances, cognitive symptoms, somatosensory and chronic pain symptoms. But we can also use this in treatments through neurofeedback to help resolve these issues. So many clinics have this idea that whiplash is a soft tissue injury, and this is an idea perpetuated by insurers to reduce claim costs. The problem is when you look at your high value clients and your premier members, they care about health and they care about recovery. So when you send them to a clinic that has this idea that whiplash is soft tissue and that whatever treatments they do are irrelevant because the person will get better anyways, it doesn't mesh well. So what makes our clinic different? First, a comprehensive examination that includes crash forensics analysis to determine injury potential. Secondly, we don't offer just a singular service such as chiropractic or physical therapy, but we offer those services and different types of those services on each visit. A patient with ligament injury may get chiropractic drop therapy for their neck, and if they have a disc irritation in the lumbar spine, they might get F&D on that same visit. Same thing goes with physical therapy, acupuncture, soft tissue. We also offer US-based therapies such as neurokinetic therapy, neurooptic and neuroacoustic therapy, and photobiomodulation. We can also offer many special in-house testing such as POCUS ultrasound, SEMG, and QEEG. Partnership with our clinic allows you to offer a premier medical service that is not available to most Canadians. Our understanding of whiplash traumatology has allowed us to gain acceptance through medical schools, chiropractic schools, medical associations, and chiropractic associations worldwide in 29 countries is the leading authority on whiplash traumatology education. Our clinic is considered a leading authority on whiplash traumatology worldwide, receiving hundreds of thousands of views each year. You have the option to give your high valued clients and your preferred members appropriate care that's timely, efficient, and get them back to work and to their life quickly, or the wrong treatment through generic PPNs that delay recovery, elongate claim durations, and increase risk.